Welcome to the press briefing. We have 4 speakers today. Controller of Center for Health Protection of the Department of Health, Dr. Ronald Lam. Principal Assistant Director of the Department of Health, Mr. Frank Chen. Principal Medical and Health Officer, Communicable Disease Branch of the Center for Health Protection, Dr. Albert Au, and Chief Manager, Quality and Standards of the Hospital Authority, Dr. Lau Ka-kin. First, Dr. Ronald Lam will say a few words. Good afternoon. As at midnight last night, the CHP is investigating 8 cases of COVID-19. Of these 8 confirmed cases, 4 are imported cases, 4 are local cases. Among the local cases, 2 cases are untraceable. In a moment, Dr. Au will give you the details of the cases. I'd like to take this opportunity to make an appeal to the public because we still have local cases, especially cases with a known origin. So we would like the public to keep to social distance, wear a mask, and also observe hand hygiene to reduce the risk of transmission. And here I would also like to report to you on a case. Today we received a report from the hospital authority about a case of unexpected or severe case suspected to be related to COVID-19 vaccination. This is a 55-year-old lady. She has chronic disease. On the 5th of March, she suffered an acute stroke. She was sent to the Caritas Medical Center for treatment, and then she was sent to the Kwang Hua Hospital for further treatment. After that, the lady suffered a cardiac arrest, and after resuscitation, unfortunately, she passed away early this morning. On the 2nd of March, she went to the Kwun Chung Sports Center Community Vaccination Center to receive vaccination. First, on behalf of the government, I would like to send our deepest condolences to the family members of the deceased. Now, after the case, the Department of Health immediately got in touch with the hospital authority. We already received additional further information and will be doing an assessment. At this moment, we could not confirm whether this case is related to vaccination. The Department of Health will refer the case to the Expert Committee on Clinical Events Assessment following COVID-19 immunization in accordance with the established mechanism as soon as possible. And then we will be publishing the findings later. And also the case has been referred to the coroner's court. And with the concerned family members, we will be doing an autopsy to try to identify the cause of death. Now I will pass on to Dr. Au. Yes, Dr. Au, please, an update on cases. Good afternoon. Yesterday, the CHP has recorded 8 confirmed cases. Cases number 11068 to 11075. As Dr. Lam said, there are 4 imported cases, 4 local cases. 2 of them are related to earlier cases. And then for these 2 cases, they were identified through contact tracing. And then there are altogether 2 males and 6 females, aged from 1 to 75. 2 cases involved domestic helpers. Case 1104069, a 41-year-old male. She arrived on 5J272 from the Philippines. And another case, 11068, a 56-year-old from 110 as a female from Indonesia. And then 116, that was 11074, and then 11068, a woman from India arriving on A130. AR3I4, and then there's a 1-year-old girl who arrived from Pakistan via Dubai on the 28th of February on EK384. And then today, for the Pakistani and the Indian case, we found the mutated strain, and then N2511Y strain. So as a case from yesterday, that is the 11059-11067. 11059 from Pakistan and 11067. We found 6 imported cases so far with the mutant strain. 34 cases in total involved the UK mutant strain, 7 cases the South African mutant strain, and 4 cases the Brazilian mutant strain, and then for 71 cases the N501Y strain. Now I'd like to talk about the 2 cases with unknown infection origin. That's 11071, 34-year-old male. He's an accountant in a computer company. Is in Lincoln House, Taikoo Place in Quarry Bay. But he's been working from home for a prolonged period. Last day at work was the 17th of February. He developed symptoms on the 1st of March. On the 3rd of March, he went to the outpatient clinic for treatment, and then he returned a sample on the 4th of March. He lives at Gong Sum Building at number 6 Hurt Street. That building's now been subject to the compulsory testing, and then he went to KFC at Shan Hong K Center on the 18th of February. On the 27th of February, he went to Hopewell, the Chinese restaurant with him there, and he also went to Wong Tai Sin. And then on the 24th of he went to a property investment seminar at Chim Sa Tsui. We asked him about the case. He said he was wearing the mask all the time. There were about 50 plus participants. We've already sent a message to these people for them to take the test. On the 24th of February, the same day, before he went to Onlin Building, he went to K11 Museum. He went to the washroom on the ground floor there, but he only stayed for about 5 to 10 minutes. He did not go to other parts of the shopping mall, and he did not get in touch to contact with anyone. And the second untraceable case number 11072, a 75-year-old male, a retiree. He lives in Cheung Kwan O, Poning Road, Funing Garden, Block 1, by himself. And this is a building subject to compulsory testing too. He developed symptoms on the 3rd of March. He called an ambulance, was sent to the A&E ward. And during the infectious period, he visited some eateries that includes the Nam Fung restaurant in Funing Garden. And on the 3rd of March, he went to local style cafe. And then on the 1st of March, he went to Hop Heng restaurant. And then on the 26th of February, he went to a Yuwa restaurant in Wen Chai. Now, for all these cases, the other cases with epidemiological link, these are family members of previous cases. They were identified through contact tracing. For 11073, that's the family member of 11067. So she also works at the Labour Department on the 10th floor of the Cheung Sha Wan government offices. Now, this building has already been subject to a compulsory testing notice. The 2 sons and the foreign domestic helper at home are all preliminary positive cases. One of the sons studies at the St. Paul's Co-ed School at 33 McDonald Road. The last day of face-to-face class was on the 24th of February, but then this student stayed at the hostel until the 4th of March. And he shared a room with another student. We are now doing contact tracing for others who've shared common facilities on the same floor, such as the kitchen, the bathroom, and so on, or those who've had meals with him, like students and teachers that they may be quarantined. And then he's taken part in some sports activities such as playing badminton. And another son stays at St. Paul's College at Bonham Road. the last day of school was the 3rd of March. Now, for these 2 cases, if they become confirmed cases tomorrow, then the 2 schools will be subject to compulsory testing notices. There's 1 case with a traceable origin. Kowloon Wat Bay, Chung K Center, A5, someone who works at the Otterbox Limited. Last day of work was the 3rd of March. This is Otterbox at 18 Hanlon Road. And then the case number is 110770. Now, the family members also preliminary positive case. The girl studies at St. Anthony School. Last day of school was the 3rd of March. And there are over 10 preliminary positive cases. For 4 cases, they have untraceable origin. I'll talk about these 4 cases. 1 case involved a 56-year-old male. He's a doctor, Dr. Chow Wai Man. He lives at number 1 Tai Kok Tsui Road, Block 7. He doesn't have any symptoms. Because of work, he takes a test regularly. On the 5th of March, he gave a specimen to a private clinic, and the case tested preliminary positive. The last negative test was on the 26th of February. He worked at 2 clinics. 1 clinic is Chun Hong Medical Center at Chin Hay Road, and last day of work was the 5th of March. He also works at another clinic at the Kwai Fong Medical Center. Last day of work was the 6th of March. He's also a VMO. That means he will work at homes, residential care homes. During the incubation period, he visited 2 homes. 333 Nam Chern Road, that's the rehabilitation hostel. He went there on the 5th of March. The other is at Lei Mok Shu Estate, Block 3, that hostel there. He went there on the 2nd of March. He didn't see any patients on those days. But we've arranged for all residents and workers at the 2 hostels to take the test. He wore full protective gear, such as the face shield, wear a mask, and protective suit, and so on, when he was at these centers. There's another case involving a 32-year-old male. He is a computer programmer at a company called Undone. It's at on the 4th floor, number 2 Carnarvon Road. He was last if he becomes a confirmed case, then the company will be subject to a compulsory testing notice. He lives in Sham Shui Po. His onset day was the 1st of March. He went to the community testing center to collect to give a specimen. The specimen is tested positive. During incubation period, he went to Pak Ho Street Market. He also went to another Wa So restaurant, and he also went to K11 Museum, to a cinema, to see a film. He used the toilet on the 4th floor. The 3rd preliminary positive case with no traceable origin is a female retiree. She lives at Hoi Fong Garden, Block 1. Now, she date of onset was the 1st of March. She saw a Chinese medicine practitioner, and then on the 7th of March she tested positive. During the incubation period, she went to some restaurants. On the 1st of March, she went to Lee Theatre, the Choi Hung Village restaurant, and then he also went to the Hong Kong Flying Club at Sung Wong Toi. On the 25th of February, she went to a restaurant called Baf and Bat at Kwai Chung, and then She also went to a restaurant in the Elements and so on. Last case of a preliminary positive case without traceable origin. He works at a construction site in Chatlapkok Airport. That's site under the airport authority. The contractor is China Construction. This is a completely different site from the one for the free one-way system. For this patient, he lives at Yanqiao Street, number 1 to 9. He does not display any symptom now because his company required testing, so his specimen tested positive on the 9th of March. For his the works construction site is for the construction of automated people mover belt and tunnel section. The site is at the interchange near the northern part of the side of the airport. We have approached the airport authority. There are over 400 workers there. On the 4th and 5th of March, there was a round of regular testing, and so this case was identified. There were about 30 colleagues who worked with this patient, and they will be listed as close contact and will be sent to quarantine. And now the latest development about the Mr. Ming Chinese dining. Then there are now 6 recent. There are 6 other cases who've not been to the restaurant but who've been to K11 Museum. That includes the 2 employees at the Cartier shop on ground floor of K11 Museum. And then there were 2 cases who visited Cartier for shopping on the 24th of February. But they were at the shop at different times. And then on the 19th of February and 20th of February, one case went to a restaurant on the 5th floor, and there's an employee working at a cookie shop. Now we have asked the Hong Kong University to do genetics analysis for some of these cases. The findings show that for the Mr. Ming's cluster, the Cartier cluster, the cookie shop cluster, and another restaurant cluster, the genetic sequence shows that they may all have shared the same origin. So we've been studying the epidemiological information. We found that it's very possible that on the 14th of February, or around that period, there was one case that visited K11 Museum, and it's possible that we've not been able to identify the case. It could be an asymptomatic patient, and that patient then passed on the virus to the 2 shoppers at Cartier. The employee of Chinky Cookie and also the Mr. Ming and Mr. Ming cluster. And then there's another super spreader at the Mr. Ming's, and so then the cluster developed. For the 2 employees at Cartier, could they have infected each other? It's possible, because if we look at their onset date, it's several days apart. For the 5th floor case, we believe that on the 19th or the 20th of February, when she visited K11, she could have come into contact with other cases, because for those 2 days, there was the first case at Mr. Ming's and Cartier.
We believe that this outbreak was due to some cases where people contacted other cases in the public areas of K11, or due to environmental contamination and also poor ventilation at Mr. Ming's China restaurant, China dining restaurant, resulting in a super spreader. I think we have issued a second compulsory testing order to all staff working at K11. 1,800 staff between the 3rd and the 5th of March have been tested, and they have all been tested negative. Mr. Lau will now report to us regarding the situation at TMHK. As at 9 a.m. this morning, during the last 24 hours, we have reported 20 cases. Over the last 24 hours, we have one more patient who passed away in a public hospital. This is an 80-year-old female patient with a chronic disease. The case number is 10379. She was taken to the QE hospital and sent to the isolation ward for treatment. Her condition continued to deteriorate, and at 9:55 last night, she passed away. Together with this patient, we have a total of 196 patients who have passed away in public hospitals. Over the last 24 hours, another 18 more confirmed cases have been discharged. We now have a total of 10,622 patients who have been discharged. As at 9 a.m. this morning, we have 215 patients staying at 22 hospitals and the AWE Community Treatment Center and the Infection Control Center at Lantau. We have 12 in critical condition, 15 serious, and 185 in stable condition. Number of negative pressure bed, 1,191, 59% usage rate. Negative pressure ward, 661, usage rate 61%. It is now questioning time. Please tell us the organization you represent before you ask a question. Now TV, 3 questions regarding one case of unknown origin, and there is also another preliminary case who had gone to the toilet at the ground floor of K11. Do you think it's appropriate for the K11 to be reopened today? And also regarding the case of Dr. Chow Wai Man, who are the people who have been in contact with in the course of work, and how do you propose to conduct the contact tracing? And regarding the 55-year-old female, what sort of stroke did she suffer, and what sort of treatment did she receive? What was it possible that the treatment was the cause which led to her death? Let me first talk about the case 11 case, and then Dr. Au could supplement. Yesterday, we, together with an interdepartmental team, including the EMSD, the EPD, the buildings department, and so on, we conducted a comprehensive assessment and investigation. Basically, we were looking at whether or not there are any environmental risks, including the ventilation system and the vents. We also have we've also looked at all the people who have, the places where those affected patients have visited to conduct an assessment. In terms of the environmental assessment, overall speaking, the ventilation system, the supply of fresh air, and the ventilation vents, I think for the entire building, we have not seen any high-risk factors. According to the EMSD and the EPD's experts, it is the assessment that the data they found, including the data, including the past record supplied by K11, they have not seen any obvious, evidence. They made assessment at the different places where the patients had frequented, and we've actually identified some risk factors, which Dr. Au already alluded to earlier, including some ventilation outlets. For example, the ventilation vents at the Mr. Ming's restaurant. It's very likely that some people have been smoking in that area. And because on the ground floor, we found some cigarette butts. In the risk assessment process, we have in different locations, including the Mr. Ming's China dining restaurants, pantry, and the sinks there, and also the handrail of the trolleys, and also some of the ventilation inlets and outlets. We have actually found the presence of some virus there, which could account for an environmental transmission. So obviously, probably there was, one case with a very high viral load, which led to the transmission. And at the scene, we also look at, some areas where common activities were performed. For example, at the place where people, where the corridor where people walk by to dump the garbage, for example, or we understand some of the patients were smokers, and normally we've also looked at the place where they would be smoking, and we've also found some cigarette spare. All such environmental evidence suggests that there might that could be the cause of the cross-contamination. I would like to also make an appeal here, which we've done before, that is smoking and being infected by COVID-19 could be related, because when you smoke, you would remove the mask, and that would increase the risk of infection. Smoking would also weaken your lung functions, and if you were infected by the virus, I think the disease would be more serious. So I therefore like to appeal to the smokers to take this opportunity to quit smoking, and the Department of Health also provides service to help people quit smoking. Regarding the 55-year-old patient and her clinical condition, perhaps Dr. Lau could supplement. The 55-year-old female patient has a chronic disease. She suffers from hypertension and hyperlipidemia, and also and at around 7-something, she felt that the left side of her heart she felt that it was weak. So the ambulance was called to take her to the A&E ward of the Caritas Hospital. The clinical, symptoms, and after a scan was taken of her brain, we discovered that she was suffering from a stroke resulting from an ischemic, stroke of the brain. So she was taken to the ward, and upon examination by her doctors and after consulting with the family, the doctor provided some medicine to hopefully to actually clear her arteries which were blocked. After treatment, the patient was sent to the Kwong Wah Hospital neurological, ward. At around midnight, her condition suddenly deteriorated, and her heart actually failed. And after rescue, she was taken to the ICU, but unfortunately, her condition continued to deteriorate, and at 4:51 this morning, she passed away. So she actually, her condition deteriorated very quickly and passed, and we've actually passed on the case to the coroners for follow-up. We understand that she took the, vaccine on the 2nd of March, the Fuxing vaccine. We've already notified the headquarters of the HA and the DH, and we will provide more information for the expert committee to follow up. Regarding the case of Dr. Chow Wai-man and the contact tracing work, well, this is still a preliminary confirmed case. The 2 clinics she worked in, well, the doctor does not have any symptoms. She submitted a sample which was found positive on the 5th of March. So we follow the usual contact tracing practice that if we trace his contacts over the past 7 days, and we asked his clinic to provide details of all the patients who've patronized the clinic since the 26th of February, and asked them to be tested. We asked them for a name list of the patients and the contact numbers. As for the staff at that clinic, if they were close contacts of Dr. Chow, say if they were having meals together, have been in close contact for a long time, or working in the same clinic, we would arrange for them to be taken to the quarantine center. Our investigation is still ongoing. I think for the time being, it is difficult to determine her cause of death. And exactly because of this, because she's only been admitted to hospital for a short time and received treatment, that's why we have referred the case to the coroner's court for follow-up. And we will also talk to her family to arrange for an autopsy to find out the cause of her death. Lady in pink. TVB. I'd like to follow up on the 52-year-old patient who passed away. Are there any records, that is, after she was vaccinated, did she tell the nurse that she had a chronic disease? Or are there any evidence to suggest that after being vaccinated, it would increase the probability of a chronic patient resulting in or having a stroke? Many members of the public cannot determine whether or not it's suitable for them to be vaccinated. Would you appeal to chronic people with chronic diseases to not to take the vaccine? Both cases actually were vaccinated at the Kwun Chung Sports Center. Would you like to review the arrangements of the Kwun Chung Sports Center?
Perhaps I will first answer the question of whether we will appeal to chronic patients not to take the vaccine for now. Now, under the community vaccination program, it's been actually assessed by the scientific committee, and there is another expert committee under CAP 599K. That was set up, under this regulation, Prevention Control of Disease Vaccine Regulation. And the expert committee has actually studied all the advisory panel, rather. It is an advisory panel on COVID-19 vaccines. They will consider whether the vaccines are suitable for use, and then with the approval of the Director of Health and or the Secretary for Food and Health, then the vaccine could be brought in. And then there is a joint scientific committee under the Center for Health Protection. They are looking at the two vaccines that have been introduced, and they're looking at the safety data. And then they've given recommendations on points to note when using the vaccine. It's stated clearly which groups should not take the vaccine, or for which other groups they should first consult the doctor before receiving the inoculation. Now, so we do have free channels for the public to find out whether they could take the vaccine. The first point is that when they make an appointment to with the community vaccination program, then on that web page we have already listed out all the points to note and so on in the page, and they have to then take answers to questions before they could proceed with the making the appointment. That's the first thing, first channel. And second channel is after they have taken the vaccine, they will have to stay at and then our medical staff will give them information and also they are allowed to they could ask questions of if they say they have a chronic disease, if they feel unwell, then at that point the healthcare workers could help with examination. That's the second point before vaccination. And then at the vaccination center, now before taking the vaccination, when data is input into the EHRSS system, e-health record system, then questions could be asked by the healthcare workers. So that's another checkpoint there. If it's the coronavac vaccine, then the manufacturers recommended 30 minutes of rest for observation, and during that time the people could ask questions, and after people leave the vaccination center, we have mechanism for reporting unusual extraordinary events, or rather adverse events of some special interest and so on. Now, because we have actually a stringent monitoring system, so we could get information and data on unusual cases, and then follow up on those cases as soon as possible. So there are at several points that we would actually check whether the person is suitable for taking vaccination. At the first point, people will ask questions, and they could also consult doctors whether they should take the vaccines. Now, so which groups should not take the vaccine? Now, the scientific committee studied the data provided by the pharmaceutical company. There are several groups who shouldn't really take the vaccine. For example, those who've taken the activated virus vaccine and who've had allergy. That's the first group. Second group, those who've had a serious allergic reaction to vaccines. And the first type is those with a severe central nervous system disease, and then the fourth type are chronic patients whose conditions not been brought under control, and the fourth group are pregnant women or breastfeeding women. Now, let's say for those who have chronic diseases but the condition is stable, well, then it depends if we talk about severe chronic illnesses, or if the person has other conditions. Then we've actually recommended doctor's assessment first before the person should decide whether to take the vaccine. So we have comprehensive set of monitoring mechanism. I wonder if my colleagues have anything to add on. Now, for that particular patient, she had chronic illnesses, but then from the time of admission to hospital to the time she passed away, it was short. So our diagnosis is a cerebral infarction. So we have therefore given treatment accordingly. And in any case, we refer the case to the coroner at once. Hopefully we could find out the cause of death for this particular patient. Next, please. Sorry, speaker's not coming through. Oh, for Kwun Chung SWAT Center. Now, we have a central command center. It will monitor the different vaccination centers. That's one thing. The other thing is the quality management monitoring group. This group will do regular training for staff working at the vaccination centers. They will also do regular inspections. For example, at Kwun Chung SWAT Center, Community Vaccination Center, they have actually checked that the procedure was in order, and so far we've not seen any exceptional circumstances. Now, and also, together with the Hong Kong Academy of Medicine and the Hospital Authority, we have put in place a training program for healthcare workers at the vaccination centers. They must first have gone through the relevant training, so they are fully familiar with the procedure before they could work there.
Next question. Ming Pao Daily. I have a question regarding vaccination. Regarding the 55-year-old woman who suffered from a stroke, how was her chronic condition controlled earlier? Was condition controlled, satisfactorily? Does it have to do with her passing away, or did the vaccination cause the deterioration of her condition? And since the beginning of the vaccination of the coronavirus vaccine, there have been 17 adverse incidents. Other than the 2 mortality cases, have there been any other serious cases? Secondly, regarding the K11 Musea shopping mall. A few days ago, we learned that the environmental EPD found 3 environmental samples at the Mr. Ming's restaurant. Today, Professor Yuen said that there is a total of 8 positive samples found. So where did you find those extra, samples? Does it include the, air ventilation vent of the Mr. Wing's restaurant? Professor Yuen said that there's a lot of cigarette butts found in the area, and suspect that many people have been smoking there near that ventilation vent. So for the Cartier and the Twinkle Cookie staff and the other customers at K11, had they been to that location? Had any of them been smoking there and as a result become infected? Would you also take some samples from there to see whether or not there's still some remaining viruses there? And today, the K11's Musea is reopened, and the shopping mall is offering many concessions to attract customers, and hundreds or even close to 1,000 people are queuing up to go to that mall. Do you think that there is a potential risk of transmission here? Would you be worried that there will be a second outbreak there? I think Dr. Lau could perhaps take the first question, and then Mr. Chen, Assistant Director, can talk about the 17 cases. According to the information available to us now, the patient is suffering from, hypertension, hyperlipidemia, and we understand that she had been, having, going to our OPD clinics regularly. Well, she passed away this morning. Before she passed away, we've been in touch with her family and have looked at her records. And such records, once we have compiled them, we will pass them on to our expert committee for assessment to determine the causal link between the vaccination and her passing away. As for the reason of her death, like I said earlier, she actually passed away rather suddenly from the time of at 7-something on the 5th of March. She felt something wrong with the left side of her heart, and the time she passed away, it was only a very short interval. So far, we have not been able to determine the cause of her death, and that's why we've actually referred the case to the coroner's court for examination and to perform an autopsy to find out the real cause of death. Let me explain the mechanism as to how we monitor the adverse incidents. When the HA receive any adverse incidents involving vaccination, they will notify the Department of Health. We would also collect now for the 2 vaccines that we have approved, we will collect relevant information from the 2 companies supplying the vaccines. Now, as of yesterday, we have received a total of 18 cases, one of which is not serious. The main complaint was headache and discomfort. There are 17 other cases, including the mortality case, and the other 16 cases. For the other 16 cases, the patients all had to be admitted to hospital. So in the reporting mechanism, these are regarded as serious incidents. The major complaints would include, headaches, palpitation, or discomfort at the chest. We've also received some data from the pharmacological company. So the supplier so far has supplied, 4 44 million doses of the vaccine worldwide already, and they so far received 56 mortality cases. But upon assessment, it was found that they were not due to the vaccines. Regarding the 56-year-old female, we will collect data regarding her clinical history, and also information provided by the pharmacological firm and the information from the WHO, and refer them to the expert committee for assessment. Regarding K11, together with the FEHD, we've been to the K11 museum twice. On the first occasion, the EBD, the EMSD, ourselves and Professor K.Y. Yun went to the Mr. Ming's China Dining Restaurant on Monday for an inspection to see whether there are any environmental factors which caused the outbreak. We took 48 environmental samples on that day, 3 of which were found positive. The 3 samples were collected on the ground floor of the restaurant. For all the cases involving the customers, all 22 such customers were stay at the lower floor. And we also found some positive, sample in the ventilation vent on the ground floor in the eating area, and another one in the pantry, and another one in the sink. And also on the handrail of one of the trolleys, we also found a positive sample. EPD colleagues on the 4th of March went there again to take more samples. On that day, they collected 29 samples, of which 4 were found positive. 3 of them were found on the ground level near the the air conditioning filter. Basically, these aircon filters were used to actually, extract the air, and all the samples collected there were positive. Another sample was found at the aircon outlet of the pantry. Again, it was positive. All these environmental data have proven Professor Yun's conclusion when he carried out the inspection on Monday. It was his analysis that on the 19th of February at around noon, one patient or index patient during his infection period went there to work on the ground floor, and it's likely that there was a case of a super spreader who contaminated the air and resulted in a infection. Like Dr. Lam said, EMSD, FEHD, and the building department also went there for an inspection. At the Cartier boutique, there is an outbreak. 2 staff and 2 customers who patronized the boutique or paid a visit were found positive. So at the Cartier boutique, we took 17 samples. We haven't have any, we don't have any conclusions yet. We'll follow up on that. In the cases at Cartier and the Mr. Ming's restaurant, we found out that the genetic sequence of the samples found were very similar. So we believe that they come from the same origin. But we still don't know what is the origin. The 2 persons who patronized the Cartier boutique, the only time they went to K11 was the 14th of February. We believe that on that day there was an invisible or silent, transmitter or carrier who infected those 2, customers. For the Mr. Ming's restaurant, before the onset of disease, the only day he went to work was on the 15th of March, and the onset of this on the 18th. In between, he didn't go to work. So it's likely that on the 15th of February, he was infected in some common areas at K11 and caused the further transmission at the Mr. Ming's China Dining Restaurant. Regarding the risk of reopening K11 Museum. Now, first of all, according to the proprietor of the shopping mall, all staff working at K11, that's around 1,500, 2,000. They have actually taken 2 tests already, and according to our understanding, all such tests were found negative. And secondly, we have all along been appealing to the public that in crowded places, in the midst of the pandemic, people should avoid going to crowded places and put on their wares and observe hand hygiene. Next question.
Hi, RT. First of all, I'd like to ask about the vaccination. The 55-year-old woman who died. Can you talk about the vaccination program protocols, because we've already seen 2 deaths within a week, days after the patient or the person received vaccination. What's the vaccination protocol when we have serious incidents like that? Why are the authorities not conducting tests and suspending the program until you can rule out that the deaths are 100% not related to the jabs that they received? And can you also talk about, let us know whether the doctors giving the patients treatment and resuscitation, whether they were aware that the patient had taken the coronavirus vaccination during the treatment, or they found out afterwards when she passed away. Regarding K11, given that there are 2 more new cases, 1 preliminary case that are linked to who had been to the K11 Museum Mall, any correlation, any concerns that these 2 cases might also have been linked to the earlier cluster? And also, can you update us on the investigation results, because you mentioned that the DNA sequencing results show that it could have been one super spreader spreading, infecting the whole cluster. How is the Cartier cluster correlated with the Mr. Ming Chinese restaurant cluster? And also, I think that's it. Thank you.
Okay. For the first question, indeed, the 2 vaccines currently adopted for use in our current vaccination program have undergone a very vigorous scientific evaluation by both the expert committee set up under the law CAP 599K, and also undergo assessment by the Joint Scientific Committee under the Center for Health Protection. So they have evaluated and looked at the scientific data for the 2 vaccines and come to the conclusion that the use of the vaccines in target groups have benefits far exceed than the risks. So this is the underlying reason why we are using the 2 vaccines. And secondly, for the case that is succumbed to the disease reported today, we know that the case had chronic diseases. However, whether or not the cause of the death is related to the use of vaccine, or whether or not it has direct or indirect correlation, we need to refer the case with full clinical details to the expert committee on clinical events, after immunization, for very thorough deliberation, and try to see if there is any causality. We have already referred the case to the coroners, and also if with the consent of the family members, we would send for the autopsy as well to ascertain the cause of the death. And upon receipt of our referral, I think the expert committee will try to convene the meeting as soon as possible to look at the case to ascertain if there is any cause. However, I would like to reiterate that as both the Joint Scientific Committees and the expert committee set up under the CAP 599K had see to that the use of vaccines in these priority groups, including those elderly, have benefits far exceed that of the risk. So we, at this stage, unless there are other conclusions drawn up by the expert committee, we would continue the vaccination program. Right. So for the clinical, yeah.
The relatives of the patient have told the nurses and the doctors in the accident and emergency department, as well as in the different clinical settings, that the patient has received the COVID vaccination on the 2nd of March. So our colleagues knew that the patient has vaccination during the treatment of the ischemic stroke, as well as during the resuscitation. Because of this, after the patient succumbed, died, our staff has immediately informed the management of the hospital, as well as the hospital authority head office, as well as the Department of Health.
For the K11 situation, yes, today we have a confirmed case, 11071, who had visited K11 museum, but just for a very brief time period. And he had onset of illness on the 1st of March, and he told us that he has went to a toilet on the ground floor of K11 museum for about 5 to 10 minutes on the 24th of February. But however, during that visit, he had wore surgical mask, and also he just went to the toilet without going to other places, and he has no contact with other visitors or persons there. But however, inside the washing room, he has took off his mask and also washed his faces for a very brief moment. And for another preliminary positive case, the case had onset of illness on the 1st of March, and the case has went to K11 Museum Art House on the 4th floor for movie on the 26th of February. The case also wore mask when she visited K11 Museum. And our preliminary investigations show that both cases are of unknown source at this moment. But judging from the time of visiting of K11 Museum and also the day of onset, it is possible that both cases might have acquired the infections in K11 Museum. It cannot be excluded. But however, our investigation is still ongoing, because judging from the history and also their visit, it is the possibility of getting the infections in K11 Museum exists, but the chance is not that high, because from the confirmed cases recorded so far, there is no cases who had appearing in K11 Museum during the period. But however, we will do further investigations, including we will liaise with the University of Hong Kong to do genetic sequencing for these two cases, to see whether the genetic sequencing is the same or different from other cases in the Mr. Ming dining cluster and also in Cartier.
下一個問題啊，呢邊藍色衫呢位。
Next question, the one in blue, please. And for commercial radio, for this 55-year-old female who passed away after taking the vaccination. Now, was there any unusual circumstance, condition after she took the vaccine? And did she have one of the 3 types of chronic diseases mentioned by Dr. Lam earlier? And then is there a mechanism that before taking the vaccine, the patient must declare the diseases he or she has? Is there such a mechanism? How does it work? Now, there was the first step, the same question was asked. Now there's another. You still claim that it's not related to the vaccine. So are you confident that you could continue with this vaccination program and people will have confidence in it? Would you definitely not consider suspending the program So you would definitely carry on with the program, right? Because you say the benefits far outweigh the risk. And a question for Dr. Lam, you said the patient felt, that she has no strength on one side of her body. So what's the condition like?
We have not received any information as to anything, whether there was anything abnormal during the time of vaccination. Secondly, like I said earlier, we are using the existing vaccines in this vaccination program because we have two panels of experts who have assessed the vaccines. And the scientific data they looked at, they've also looked at the phases 1, 2, and 3 clinical data. For the data, clinical 1 and 2, they were basically looking at the questions related to dosage, safety, the efficacy when the vaccine were applied to the target groups and so on. During phase 1, it was found that the vaccines were safe for people over the age of 60 and was able to actually generate antigens or antibodies. While there were fewer people involved in phase 3 of the trial, they were looking at the data. We will continue to monitor the data collected from the large-scale vaccination program. Now, while at the time of vaccination, this patient, we did not receive any irregular information or notice when she was vaccinated. But we do have a sick bay at the vaccination center. If any patient felt unwell, we would ask them to rest there, and we would keep detailed records. But for this 56-year-old lady, she had not actually requested to take a rest at the sick bay or require any medical assistance. So at that moment, we have reasons to believe that there was nothing abnormal, which, at the time she took the vaccine. As to whether the vaccination program should continue. Now, for the epidemic, in Hong Kong, we now have more than 10,000, infected cases and 201 fatalities. Amongst the 201 fatalities, more than 88% of those who pass away are elderly persons over the age of 65. The median age is 80. So the scientific committee and our experts' overall assessment is that the efficacy of the vaccine far outweigh the risk, and therefore, before we can establish any causal relationship between the vaccines and these incidents, it would be rash on our part if we were to suspend the vaccination program, and it would really deal a serious blow to our effort to fight the pandemic. Regarding the data, of course, the committee, in assessing the adverse incidents, that committee will convene a meeting soon to look at this case. Perhaps I was a bit confusing earlier. The patient was actually feeling weak on the left side of her body. The lady in a check shirt, Oriental Daily, regarding the 55-year-old patient. Well, she had a chronic condition, and so I think whether or not she should take the vaccination, that the crucial factor is her chronic condition. So at the vaccination center, does it have a responsibility to keep records of such data? You don't have such data. Will you collect such data in future? And Dr. Au talked about the K11 case, and he said he would not rule out the possibility that those persons were infected at K11, but the probability is not very high. For these two cases, now for the K11 cluster, there is a very large number of patients. So how many are there so far? The panel of experts will convene on Monday to discuss this incident. What information is still lacking? Why can't the committee immediately call a meeting to discuss this incident? And our colleagues also asked the question regarding, public health. That is, since we cannot establish any connection between the vaccination and the two cases, shouldn't we, put a hold to the vaccination program and provide, a clear account to the public? At the community vaccination center, we do collect, data from those centers. We do have a 30-minute observation period, and during that time, for anyone who has received the vaccine, if they should feel unwell, they can immediately, alert our staff there, and there is a rest station there, and the medical staff on site will take care of them. And, so we do keep such records in all of our community vaccination programs. And if someone has gone to the vaccination center and registered, before registration, the person will need to read the important points to note, and he can also ask questions of the medical staff on site. And if they feel uncomfortable at that moment, they can also alert our staff. So at these vaccination centers, we all have these medical personnel, on site. So if there's any condition taking place, we would have record. Well, the report asks anything irregular took place at the time of vaccination. Now, we cannot be absolutely sure whether or not anything irregular happened at that moment of vaccination, but at least in the record from the sick bay does not show that the lady had indicated that she was feeling unwell or request for medical attention. So we have reason to believe that there was no, abnormal condition on her part. You ask about the Joint Committee on the Assessment of Adverse Clinical Incidents, which will only meet in Monday. I believe they will only meet in Monday because they need time to collect more clinical data. Now, if I may further add that, like the earlier cases, the data that we collect will include the clinical data concerning the patient herself, her clinical history, her life habits, her psychological condition at the time of admission, whether she had any allergy to any particular drugs, and whether or not she had taken any other drugs resulting in her condition deteriorating, and whether or not she had been cutting down on her regular medicine or taken more than she needed to. So we are not able to see any connection between the vaccination and her condition until we have the consent of a family and perform the autopsy before we can find out the real cause of death. After collecting all such data, we will need to look at the latest latest data as to what regarding the abnormal adverse incidents after vaccination worldwide, and also we will sum up all such information, and then we will follow the approval guidelines of the WHO and refer them to the committee for assessment. Only then will we be able to have a more comprehensive report. Regarding the two cases of the confirmed cases of the preliminary case which have been to K11, we're still treating them as cases of unknown origins. To determine whether there's any epidemiological link between two cases, the two persons involved will need to be acquainted with each other, and there would have to be a direct contact, or whether and if there is an outbreak at a particular premises, as in the case of Mr. Ming's restaurant or at the Cartier boutique. So even if the two persons were not acquainted, if they've been in the same place, then we will consider them to be epidemiologically linked. We will also rely on supplementary data like the DNA sequence. For the two staff at Twinkie, Cookie, and Cartier, the genetic sequence of the virus were the same. They also appear at the premises at the same time. So there is therefore we can establish an epidemiological link. For the case today, the patient had been to many places, including restaurants, and she also attended talks and had been in touch with many people. And during the incubation period, she's only been to a toilet at the museum, K11 museum, for a very short time, and she also had a mask on. While we can't rule out the possibility, but as whether or not she became infected there, we cannot just say that he's been to the K11 toilet and therefore there is a link there. So that's why we are now conducting some DNA sequencing together with the Hong Kong U. If the result confirm that's the case, and we can say that he is also part of the K11 cluster. For the preliminary positive case on the 21st of February, on that day, no other cases appear at K11. This is the only case that we know at the moment. And this patient does not have any contact with the other K11 patients. During the incubation period, he's been to different places. For example, he's been to the wet market. So the source of infection again is unknown. We will look at the DNA sequencing and see whether or not they are the same as those from the K11 patients. Last two questions. The gentleman in white.
Of a 55-year-old a lady who had the vaccine, which priority group did she belong to? And before she took the vaccine, did she consult a doctor? And before she actually took the vaccine, did she tell the staff at the vaccination center about her condition? And did the staff then assess her to be suitable for vaccination? And then did she show any allergic reaction after taking the vaccine? Was this her first stroke, or did she have a stroke before this one? How come she would die on the same day after a stroke when she's so young? Now, for the K11, if in 8, the environmental samples, 8, of the environmental samples collected, 8 tested positive, but then you only mentioned 7 samples. And then for the sample collected from the air ventilation outlet, did people actually, did those confirmed cases smoke there? Did you ask them? And now you said that there have been 44 million vaccines administered, and 56 deaths. So how many actually were in China, on the mainland? The 55-year-old lady accompanied and someone who is more than 75 years old to take the vaccine, because we have a policy that for those aged 65 or above, they could be accompanied by 2, and those 2 could then take the vaccine. Now, we didn't see any record that she mentioned anything about being unwell before taking the vaccine to the staff there. Now, I've checked the record. There's no mention of any allergic reaction as a symptom recorded in her medical history. Of course, we'll be sending all the information to the expert committee, but so far we haven't got any information about previous stroke cases involving this patient. Now, exactly because she passed away so soon after being admitted to hospital, so far we diagnosed her to have ischemic stroke, but then we have to refer her case to the coroner to find out the actual cause of death. For Mr. Meng's Chinese dining at case 11, I understand there are 7 positive environmental samples. We found 7 samples in total for the ventilation outlet. Now, they started with employees. Onset was on the 18th of February, and then the employee continued to work at the restaurant, and then so he caused further infections. But we believe the first case actually or rather the index patient was not the Mr. Meng's worker. So we don't believe the worker at Mr. Meng's was the index patient for the whole K11 cluster. We believe that the index patient was there earlier, say around the 14th or the 15th of February. There was a symptomatic spreader, either at Cartier or at K11, that spread the disease, and that included spreading the disease to the first infected worker at Mr. Meng's. Now, we've actually asked the patients whether they smoked there, and only one case told us that he smoked, but that it was not at the ventilation outlet at Mr. Meng's. 44 million vaccines administered. As for the death cases, we'll have to give you information later. Cable TV. Now, we've seen 2 death cases after vaccination in a short space of time. So can we expect more death cases? What about people taking the vaccine? There are fewer people now taking coronavac. So how can you convince the public to take this vaccine? Well, I think we can look at it at different levels. Firstly, in the whole of Hong Kong, every day, in our healthcare system, both in the public and private sectors, there are people who seek treatment for acute condition every day. And we hope more and more people will take the vaccines with the rollout of the vaccination program. So what we could expect to observe is that many of the patients who seek treatment at healthcare facilities would have had received the vaccines. This percentage is going to go up when more people take the vaccines. So what is important is that we have a rigorous monitoring mechanism for people who seek treatment in the healthcare system. We'll have to make sure whether the disease is related to the vaccine. So we have an effective system in place. So that's why if there are such incidents, they will be announced at once. What is important, of course, is that we have to check whether the condition is actually related to the vaccine, because if we don't get the cause right, then it could undermine public confidence. But then if you talk about the vaccines, or you talk about the global situation, over 110 million people have been infected, over 2.5 million people have died. And in Hong Kong, we have over 11,000 cases, over 200 death cases. Most of the death cases are the elderly. So when it comes to risk assessment and safety, the Joint Scientific Committee and the Expert Committee have actually done comparison. And they found that the benefits of taking the vaccine far outweigh the risks. Now, if we look at the phase 1 and phase 2 clinical trial data of coronavac, is safe even for people aged 65 or above. For the latest incident today, we have to wait for the expert committee to conduct an assessment. They have to see whether they could establish a causal relationship, because it's possible that people have some underlying conditions. But of course, we have to stress again, for people who have severe chronic illnesses which are not yet under control, they should not take the vaccine. But then if people have severe chronic illnesses, they are worried, they should seek treatment as soon as possible. Now, apart from the community vaccination program, we have now over 1,500 private practitioners at 1,900 locations for people to take the vaccine by appointment. And then at the clinics, the doctors could do an assessment first. And at the vaccination center, as I said, there are healthcare workers stationed there. And in the whole process, from making an appointment to actually waiting at the vaccination center, there are healthcare workers to help them. And if they don't feel well, will be taken care of. So at different points, we have in place a mechanism for assessment, so that will allow more people to take the vaccine, and then people could then develop immunity against the virus. And that's the first point. Secondly, now in Israel, the more than 50% of the population have taken vaccine, and we have seen encouraging figures. The number of infections has come down, and the viral shedding has also come down, and so on. So as we see more and more data, and if there is a higher vaccination rate, then that would be the key to turning around the pandemic. So that's why we want many people to take the vaccine, so then we could put the epidemic under control. That's the end of the press conference briefing. Thank you.